Yeah, so let us begin with Alan's keynote study streak. Namaste, Dr. Ashwin and Sanawar Ali. We have so far covered a lot of remedies, almost 90% of Alan's keynote's remedies. And those who are watching it, some clinical cases I have shared, some clinical tips I have shared, some potency prescriptions I have shared. And we have started with a remedy in the initial days and continued with a relationship of different remedies, and then we formed group of different remedies like metals, acids, complementary remedies, which remedy follows the other well, which is a very similar remedy. And in this way every homeopath should study the materia medica. Few remedies are scattered across the Allen's keynotes which we couldn't cover. One of them is taraxcum, and today we'll study that, a very short remedy, and then I'll take up a few questions from the audience about the difficulties in practice, or if there is anything that you would like to ask about case taking, about rubrics, about materia medica, about repertories, about fevers, about coughs, about daily routine practice which a homeopath sees patients in his day-to-day clinic. So we'll begin with taraxacum, and for gastric and bilious attacks, especially gastric headaches. So you will see that many patients will tell you that there is a headache happening, and there is a kind of an irritation which you hear in the talk, or they will also tell you that the tongue has turned bitter, the taste, or there is a lot of salivation happening. In those cases we can think of this remedy which is taraxacum. Patients will not tell you that I am having a gastric attack or I am having a gastric headache. It is our job to find the correlation between these terminologies and give them the remedy which suits best to this type of presentation. You will see that the tongue is mapped, either it will be having patches, there will be one patch which is dry or clean, and there will be other patch which will be discolored, or you will see that it's kind of a formed in a vague shape. Do ensure to ask the patient how many hours ago did he have the lunch or dinner or meals. He will tell you that just I had it and came, then it's obvious that it's because of that. But if it has been 3-4 hours since the time he had some meals or something to drink like a tea or coffee, and then he has come to you, it means that the tongue is mapped is a characteristic of the patient and it stays for a long time. That's when we should take it into consideration for prescribing. Map tongue, you will see taraxacum is mentioned, lachesis, Merxol, natramur are the other remedies. Tongue indented, the tongue will have marks or imprints of the teeth. It is either thick or there is imprints of teeth. You will see it is present in Merxol, Chelidonium, and in fact Podophyllum also. So many times tongue has been clinching diagnosis for prescribing the medicine in my clinic. Sometimes it is pulse, sometimes it is some physical particular like headache happening in one spot, or there is kind of a modality which is clinching the prescription in the favor of a remedy. But it is very rarely that a mental symptom will decide it. It may be so in 50% of the cases, but 50% of the cases you will see that there is this kind of a physical particular which you will need to take into consideration for prescribing. So you will see in taraxacum there is map tongue, covered with white film and a sensation of rawness. This film comes off in patches, leaving dark red tender and very sensitive spots. You will see this also in ranunculus scleratus. In fact, in ranunculus scleratus, you will see that the patches are there in the skin eruptions as well. Whereas taraxacum has these patches turned inwards, which is inside the gastric mucosa, right from the mouth to the entire gastric passage. If you are able to detect something unusual, which is not normal, from the patient's tongue, that's where the investigating mind of a homeopath should begin. You should directly think about the diagnosis and then consequently the remedies which you can or you should be giving to such patients. You will see that taraxacum is a remedy which we will often miss to prescribe in cases of jaundice, but if you will give this, it will be having map tongue and jaundice. That's the only indication you will see in ALM that is mentioned. Debility, loss of appetite, profuse night sweats, especially when convalescing from bilious or typhoid fever, restlessness of limbs in the typhoid, rust ox and zincum. Now, when a symptom is mentioned for a particular diagnosis, like for example fever, there is a mention for restlessness of the limbs. It does not mean that the patient will be telling you that my legs keep on moving when I am having fever, or even the relative will tell you that the patient's legs are moving in fever. It's very rare. This is the skill of a homeopath where he'll have to work on it and observe those patients. In my clinic, for example, whenever a cough patient comes, I make them sit for 10 to 15 minutes or at least for a span of 5 to 7 minutes when I can observe the cough. You cannot rely always on the data. Data will give you modalities, but the data will not help you understand the type of cough. What will be the different types of cough? I have recorded different types of cases of coughs and they'll be put up in a workshop very soon. If you are connected to me, you will experience something which is of practical utility in clinical practice. That's what I want to say, every one of you. Every symptom that is mentioned in Allen's keynotes or Boric or any other Materia Medica will not be told by patient. There will be some symptoms which physician will have to understand. For example, over here it is restlessness of limbs in typhoid. Rust ox zincum is mentioned. Taraxacum is the other remedy. Coming to an end, modalities of taraxacum. Almost all the symptoms appear when sitting, lying down or resting, and you can compare this remedy. One of the top comparisons that is given is Chelidonium, Hydrastis, Bryonia, Nux vomica in all the gastric complaints. So all those cases where we are giving those remedies, we are failing, give a thought to taraxacum, study it and prescribe it. It will serve of good help. Even though it is a small remedy, you can use it like a very sharp axe in your acute cases. So we come to an end from today's session. Good to see Dr. Rishabh, Dr. Poonam, Dr. Gauri and a few more on YouTube as well. If there are any questions anyone would like to ask regarding your practice, case taking, Materia Medica rubrics or repertories, you can just type in the comments so that I can take those up and answer them. Anyone would like to ask any question? Debility. Yes, what is it that you want to know about debility, Dr. Sanawar Ali? Can you be a little more specific? From just one word, It's not clear to understand your question. Anyone else who is in the live and want to ask any questions? What kind of debility? So, are you, if you are asking about taraxacum and the debility which is faced by taraxacum, it's not so uh, bad as we see for the other acid remedies that we have learned, but there will be a sort of a weakness. Now this is a very big symptom, elaborate symptom, and it will not be clearly classified from one remedy to another remedy. We'll have to club it with another symptom which is present in the patient. It will be debility with map tongue. Suppose there is just weakness in fever, lot of weakness is going on. You check the tongue of the patient, there is no other particular found. Body is warm, sometimes there is sweat, sometimes chilliness. It's not clear what is first, what is later on. And for this I have taken fever workshop. Not taraxacum per se in the fever workshop was covered, but how do you take a fever workshop? That is what I have covered. You can definitely ask for the recordings. You can message us so we can provide it to you. And what is interesting is that to understand debility of a remedy, it's very difficult unless it is not, you need to club it with some symptom. Over here it will be map tongue or gastric, excess secretion. Bilious means that there is excess of bile secretion, bitterness or bile which comes out, green vomiting, or there is headache with the eructation, something like that. With the weakness, there will be profuse night sweats, or the patient is recovering from typhoid fever and the weakness is still there. Many of the patients will tell you in typhoid fever, when they are trying to recover, they have a lot of weakness. Instead of giving tonics, we should give them taraxacum. Dr. Shiva Ranjitham 87. In case of old age patient with ONE, how our prescription will be based on? Very nice question. I like it. I am currently having many patients who are having osteoarthritis, and if they are in their above 50, of course, then we can think of osteoarthritis nosode per se and give it intercurrent, not on a daily basis. I give it every 3 days, one dose, every once a week, one dose, depending on the case. And if it is early osteoarthritis, think of premature old age remedies. It can be lycopodium, it can be barytacab, it can be something like that, that is having premature senility. If it is a person who is old age, one of the patients I gave OA 1000, osteoarthritis nosol 1000. Every 3 days I used to repeat with the constitutional, of course. Constitutional was going on once a month, one dose. In another patient, it was going on every 2 days constitutional. What happened was he improved very well on osteoarthritis nosode and the constitutional side by side going on. It's like you are taking the patient, pushing the vitality, the entire patient's vitality ahead with the constitutional, and the local part with the osteoarthritis nosode forward. That is one idea. Another idea, once the osteoarthritis nosode starts working, the pain reduces. I taper them off from osteoarthritis nosode and I have given them remedy which is suitable for their current symptoms. For example, one of the patients was very well improving on pulsatilla. He had osteoarthritis also. He was not getting better with pulsatilla in this type of complaint. So pulsatilla was going on every 3 days, every 5 days, but I gave him osteoarthritis nosode 1000 every 3 days and it caused a good change. Once all his complaints settled, he had some minor disturbances which got improved with Conayam later on. So it is not that all the patients who are on chronic troubles will require one remedy. You will require a series of remedies to cure such patients, and that is why you should learn all the different types of methods and prescribe. So I have typed the name of the medicine in the comments, and that's all. I think we have two questions, and I hope I answered them to my best knowledge, practicality that you need, and we'll make a move. And stay tuned for any more uh, new learnings from this page, and let me know if you have learned something or you have any questions in the comments of this video.